Hello and welcome. My name is Fintan and I work in healthcare. I believe in letting nature take care of us when it comes to our health. So today I'm going to talk about carpal tunnel syndrome treatment without surgery. People ask me, is it possible to have carpal tunnel syndrome treatment without surgery? Well, the answer is yes, it is. Carpal tunnel is quite a common condition. It occurs when extra pressure is placed on the median nerve, leading to less sensation to our thumb, index finger and middle finger. It also affects the ring finger but not the small finger. The median nerve traverses the carpal tunnel just where it enters the hand. People complain of pain, weakness, numbness around the hand and wrist area. The median nerve strengthens the muscles at the base of the thumb. However, the condition affects the strength in the hand and the fingers. Carpal tunnel syndrome can occur at any given time. Usually it starts out slowly and the earliest symptoms are tingling or pain or both in the fingers, especially the thumb, the index and middle finger. People often complain of hand numbness, especially at night. Some of us sleep with our wrists curled up, so this may account for the numbness at night to the extent that we wake up. By shaking the hand, it usually relieves the numbness in the earlier stages of carpal tunnel syndrome. People report decreased feeling and tingling during the day in their fingertips. They also find it hard to lift small items like grasping a car steering wheel, for example, writing or holding a tablet or a book. They also report finding it difficult to use a computer keyboard. The symptoms become more regular as the condition worsens. The hand becomes weaker and people find it more difficult to perform simple, everyday tasks such as tying a shoelace or zipping your trousers up, like fastening a button on a shirt. It's not uncommon for people with the advanced stage of the condition to keep dropping things onto the floor. As the condition gets severe, the muscles visibly shrink at the base of the thumb. Carpal tunnel syndrome diagnosis. So following a visit to the doctor, your symptoms and medical history will be discussed and your doctor will conduct a hand examination before performing the following tests. Phelan or wrist flexion test. The doctor will ask you to rest your elbows on the table and let your wrists hang forward freely. If you have carpal tunnel syndrome, within 60 seconds you will feel tingling and numbness in your fingers. The faster the symptoms appear, the more it may indicate how severe your condition is. Tinel's sign. During this test, the doctor will tap over the wrist where the median nerve is located to look for a tingling feeling in the fingers. Should there be limited wrist motion or signs of a trauma or arthritis, you may need an X-ray of the wrist. And the last test is EMG. Electron myography studies how well the nerves in the hand are controlling the muscle movement. So what are the carpal tunnel syndrome treatments? Well, surgery for carpal tunnel is usually the last resort. Other non-surgical treatments will be tried beforehand. For example, like wearing a wrist splint at night and taking anti-inflammatory drugs. Sometimes a cortisone injection is needed for temporary relief of symptoms. And they may look at your work situation where maybe your workstation changes might be needed, like lowering your chair or changes in where and how you place your hands when working on the computer. So surgical treatment for carpal tunnel. If the non-surgical treatments don't lead to an improvement in the condition, the recommended course of action is surgery to alleviate pressure on the tendons and nerves that go through the tunnel. Surgery will make the tunnel larger and allow more room for the nerves and tendons to work better. The procedure means a cut in the transverse carpal ligament. This releases the ligament covering the tunnel at the bottom of the palm. Carpal tunnel surgery is usually performed on an outpatient basis under local anesthetic, so you won't be asleep unless you request sedation. Following the surgery, there may be some discomfort for between 24 to 72 hours. Relief can be experienced the following night after the surgery. The stitches will be taken out between 10 to 15 days following surgery, and you will be given hand and wrist exercise program to bring the strength back to your hand and fingers. You won't be allowed to do heavier activities with the injured hand for a period of 4 to 6 weeks. The recovery time frame depends on the individual's general health, age, and how severe the carpal tunnel was and how long did you have the symptoms. Several people that have had the surgery done do attain full relief from all the symptoms. However, where there is severe carpal tunnel syndrome, progress may be slow after surgery and may never fully complete. In some cases, the condition can come back, although this is uncommon. So, how do you get carpal tunnel syndrome treatment without surgery? There is a natural alternative to carpal tunnel surgery treatment in the form of a safe, effective proteolytic enzyme called serrapeptase. Serrapeptase is a natural enzyme. It has been used for hundreds of years as a natural healing solution for many conditions. In fact, one of my clients had quite severe carpal tunnel syndrome for several years. She agreed to try serrapeptase instead of going for surgery. So she tried the strongest dose serrapeptase, which is 250,000 industrial units. Over the following couple of months, the symptoms of carpal tunnel syndrome started to get better. So much so that she cancelled her appointment for carpal tunnel surgery. This is the unsolicited testimonial from Attracta. I was diagnosed with carpal tunnel in August 2018 and I was due to undergo surgery in September. Around the middle of August, I started taking one serrapeptase tablet every morning. The dosage was the maximum 250,000 IU. I believe as a result of taking these tablets, I no longer have tingling and numbness in my hand, and so I do not need surgery. I have also noticed that I don't have any aches and pains like I used to. I would highly recommend this product. It has changed my life. So if you have carpal tunnel syndrome and you're looking for a natural alternative, why not give serrapeptase a try? So please visit our website for more information. Thank you.